Get started. It's 4:05. Just people keep admitting others as they trickle in. So this is the first Connecting with Clinicals event. This topic is how to succeed in family medicine. This is for people who either have not yet done their family medicine rotation, have or maybe you're still on the island and you're just curious, what do rotations look like? What are cores like? Or maybe you're in that in-between stage. You just want to hear about what the future sounds like. So to anyone who's here, welcome. Please, we'll have a section for questions, and we're excited to hear from you. You don't have to turn your cameras on. If you want to just put it in the chat, this is very informal. We just want to be able to answer your questions and help you feel comfortable with what the future holds. So, who do you have on board with you today? This is your Family Medicine Clinical Interest Group e-board. Hi, I'm Jordan. I'm your president. Also available will be our hospital sites leader, Jen Tran, who is going to be in the chat because she is traveling. Our secretary, Hannah Reimer, and our mentorship chair, Megan Bethay. We are all here. We'll be answering your questions and just giving you some information about different hospital sites. So succeeding in the family medicine core rotation is different at every hospital. And remember, there are lots of sites to choose from. We can give you information specifically about California Hospital Medical Center in Los Angeles, SJMO in Pontiac, Michigan, and then the Trumbull Regional Medical Center in Warren, Ohio. Those are the three you're going to hear details about from us. And if you have questions, those are we can answer. If you're curious about Florida or New York, please share those questions and we can try and get them answered, sent out later. But we personally, we did not do our course there. So starting with California Hospital, we're going to give you guys an overview of what the core looks like, and then we're going to open it up to questions, and you guys can ask literally anything you want. So the family med rotation is entirely clinic-based. You're not working in the hospital during family medicine. You are just at the clinics. There are two doctors you work with, Dr. Lavi and Dr. Gill. Dr. Lavi's clinic is Monday through Thursday, 8 a.m. to 5 p.m. Dr. Gill's clinic is 11 a.m. to 5 p.m. Monday, Wednesday, Thursday. There is a difference, and you do not get to choose which one you go to. You are assigned. It's usually alphabetically, half and half. You don't get to ask for another one. You don't get to choose. On Fridays, we don't go to clinic because we go to didactics instead. This is at 7 a.m. and it's with the residents. So you get to participate in a resident didactic session, see how they learn, share your thoughts, learn from them. And it's just once a week on Fridays. California Hospital, for those of you who don't know, is in downtown Los Angeles. It's in the heart of the city, but you don't have to live there. There's lots of places you can live. There's only one residency program at this hospital. That's important. Every other hospital, you get to work with residents on your rotations. This one, you don't work with residents at all. You're working directly with your attending physicians in the hospital, or in this case, in the clinic. We only meet the residents in that didactic session once a week. And when you go to do your surgery rotation, once a month, well, monthly, there will be a resident doing their MSK rotation that will work with you. But other than that, we have no contact with residents at CHMC. The next one up is going to be about SJMO, which is Megan and Jen's hospital. So Jen will be in the chat adding details, and Megan's going to take it from here.
All right. Hey, guys. I did my course at SJMO, now Trinity Health Oakland. It's in Michigan. So the way family medicine works is that, sorry, that's my kid, that there's no residency program there as far as family medicine goes. Most students go to a outpatient site called Clarkson Medical Group. It's a very busy site, and the schedule kind of depends on the preceptor you get. A lot of the preceptors are super busy, so usually expect to work like 8 to 5 / potentially even as late as 6, Monday through Friday. No weekends though, but sometimes, again, depending on your preceptor, You might have like a Friday off, or a Thursday or a Tuesday. It just kind of depends. Each preceptor, at least for my experience, there's one preceptor that does like OMT, which is like osteopathic manipulation therapy, kind of similar to like chiropractic. So that's cool to have her. And then there's another physician slash preceptor that really focuses on like sports medicine. So does a lot of injections. It's just random luck of the draw as far as like who you get. You can't really request anybody. They're just automatically assigned to you, kind of similar to Jordan's, just alphabetically, usually by your last name. They just kind of go down the list. I, along with the previous site senator for this site, created a survival guide. It kind of outlines the details more in depth about each preceptor and kind of what to expect. Um, I think Jordan might drop it in the chat for me, or I can do it after I get done. But that's the kind of gist of our thing. Another thing to note is just 1 hour lectures, usually right before clinic, so 7 to 8. And I think it's typically 3 days a week that we have those. So yeah, that's our site.
Yeah, and
Yes,
Jen's also sharing that you'll see the patient first, like do the history of present illness, their physical exam, and then you'll present to your preceptor before seeing them together. That's,
exactly.
I will say that is pretty standard at basically most of the sites. Like for me, in with all the patients you see at the clinics, you're going to see that patient, you're going to hear what they want, you're going to do a full physical, head to toe physical, and then you're going to report it to the doctor, and then the doctor will come back with you to
Mhm.
finish the patient encounter.
Yeah. This, by the way, the our site, and I'm sure Jordan's and Hannah's, is really all about like what you make of it. So if you really dive in and go head first and try your best, the more you do and show that you can do, the more they'll let you do. For example, family medicine was my first rotation. I didn't know what I was doing, but I just tried to fake it till I made it. And at the end, I was doing like pap smears and joint injections with my preceptor. Obviously, with her there guiding me, but yes. So that's our
Yeah,
gist.
I would say the same. Family medicine was after OB-GYN for me, and so I'd already done pap smears, and so I was allowed to do basically any of the women's health stuff that I wanted, and it was great because I put myself out there and said I can do this, I want to do this. Put yourself out there is kind of the main point of all of this. All right, shall I move on, Megan? And yeah, Jen, are you good too? I'm gonna say yes. So on to Hannah's.
Everybody. My name is Hannah. I am currently rotating. The hospital is called Trumbull Regional Medical Center. Um, if you see when they start to give you the sites that you can go to, it's listed as Western Reserve Health Education. And just in case anybody's looking to come to Warren, Ohio, it's kind of confusing because it makes you think that there's a hospital called Western Reserve, but that's like an hour away, and that's not where we are. So, if you're interested in coming to Ohio, I would either look up Trumbull Regional Medical Center and make sure that you're looking up Warren, Ohio, or look up Western Reserve Health Education. It's very confusing nomenclature, but there are students who have gotten tripped up by that and live like an hour away from the hospital. So that's something that I like to make clear to everybody. As far as family medicine goes, I might be a little biased, but I thought that my family medicine rotation was fabulous at my site. Um, it was also my first rotation, so it's kind of scary and intimidating, but we're really lucky that we do have residents to work with, and we work pretty much strictly with residents. So they're also learning and they're happy to teach you as we go along. They're fabulous. I really, really liked working with them. So throughout your 6 weeks, you'll do 1 week of inpatient in the hospital, and the rest is all outpatient at their clinic. And the way that your schedule is split up is between mornings and afternoons. You'll be assigned with different residents. And then there's 1 week during your 6 weeks where you will be each it was about each day of the week you spend it with a different attending, which was really awesome. So you do get both resident and attending time during your time in family medicine. The rotation is mostly 7 or 8 in the morning until 3 or 4 in the afternoon. Wednesdays they do didactics, which is nice. It's geared towards residents, but it's also very student friendly. I felt like I got a lot out of them. Um, Lauren Pruden, who I think I saw a little bit in the chat, she's our site senator for Trumbull. She is also working on making a guide. So any questions that you guys have in regards to this site, family medicine, feel free to direct them towards Lauren and I. But I'm mirroring a lot of what Jordan and Megan said. It was pretty similar. The only difference is that it's pretty resident heavy, which was really nice to get to work with them.
All right. So move forward here. Yeah, and working with residents, if you're interested in theoretically matching at a hospital, you want the residents to like you because the residents are involved in the match process. They do interviewing, they have contact. If their residency director says, "Do you know any of these people?" You want them to say yes with a smile and not yes and we hate them. So if you can get contact with the residents, it's a good thing. That's why I brought up on my slides that Family Med is the only residency at CHMC. Not to dissuade you, because you can definitely make friends with your residents during your electives. And there's lots of hospitals in the area that we can do electives at that are not CHMC that do have other residency programs. But it does mean that during your course, unless you want to do family, you're not going to meet many residents. And even if you want to do family, you don't meet them that much. Just something to think about, because I know there's only 2 options this far west. So, all right. Oop, went back. Now, I would like to actually quickly pause for questions about the sites that we talked about and keep finishing up on the site questions before we move on to like what actually the family medicine shelf is. So I believe one of the questions was about guys doing pap smears. I had mentioned we answered in the chat, but to continue on, doctors will never discriminate against you trying to do a physical thing. Some of the patients will refuse if you are male. Like some will refuse just in general having students do it, but I have never had anyone refuse to let me do a pap smear on them. But my male counterparts every now and again will catch a no. It's not super common, but every now and again somebody will say no. Usually young patients say no, and also like women in their 50s, because they might be there for something that they're uncomfortable talking about to somebody besides their doctor. They might even say no to you interviewing them. But that's, you'll see that as you come up. Megan answered it as well, that it also really depends on how you present it. Some patients, again, can be biased, but if you come in and you've already made a rapport with them before you jump in and say, "Would you be comfortable with me doing this?" That can really help you open doors. You don't want to come in to a patient who's never seen you before and be like, "Hi, I'm a student. Can I do your pap smear?" Usually at least speak to them a little bit, get some comfort, let them be comfortable with you. Joseph asked if it's only raw students doing rotations at sites. And Lauren answered that in Ohio, there's AUA and NeoMed working there, and also PA students. Megan answered that in Michigan, there's U of M students rotating as well. And then for me at CHMC, Ross is the only true med school that rotates through the hospital. There are PA students and NP students in various rotations, usually surgery, also OB-GYN. And I think there are a few students shadowing from one of the local med schools at the Family Med Clinic, Dr. Gill's Family Med Clinic, but they're not working the way we're working. So they're just following Dr. Gill and learning. The next question was about, let me see. Pre-match residency, that's for Hannah and Lauren to answer. I wouldn't know anything about Ohio.
Yeah, I can pipe up about that. So in the Ohio site, Like Lauren said, we have 3 residency programs: family medicine, surgery, and internal medicine. Our family medicine and our surgery residencies, they don't participate in the match. They're outside of the match, which I've never heard the term pre-match, but I'm assuming that that's the same thing. That's what it sounds like. They don't participate in the match. Um, and then our internal medicine does still participate in the match. It kind of sounds like it's a year-to-year thing. I know family medicine has had much more success going outside of the match, but it sounds like it's kind of a year-to-year change depending on what they want to do, which has been interesting to learn about. I kind of didn't even realize that you could go outside of the match.
Yeah.
Just want to say real quick that also there's programs, not any of the programs that we're talking about, but pre-match can mean what Hannah and Lauren are talking about. And then also it can mean that you still participate in the match, but you and the program director have come to an agreement to rank each other higher. Didn't know that whenever I first heard the term pre-match, so just wanted to clarify that that is something as well, that you, just so you're not confused on that term.
Good. Okay. We're gonna continue forward, and then again, if you guys think of questions, we'll have time, plenty of time to answer any questions you have at the end. So keep putting them in the chat. We'll go back to them. Don't worry about it. So, the family medicine shelf, this is the school part of your course, because your course, it is showing up, it's doing the work, it's participating at the clinic, at the hospital, wherever you're at, and seeing patients, but it's also studying, because there is a shelf exam at the end of every core. They're called shelves literally from the term off the shelf. It's literally all of the material that they consider important. And by they, I mean the National Board of Medical Examiners. It's an NBME. I'm sure you've all taken NBME exams at the end of a semester. You know how they're a little bit vaguer than your other exams? The vibes are the same. It's also 25% of your total grade. You cannot fail, like you can fail the shelf, but you'll have to retake it later. But if you get like, I believe, even though it's 25% of your grade, if you get a C, which is just above a fail, because you get A, B, C, or fail. If you get a C on the shelf, you will not get an A in the rotation, even though the math says you should. That is how they do it. People have been trying to fight it. It's kind of crazy, but just be aware, you have to study. Now, it's 110 questions. It's 2 hours, 45 minutes, plus the 15-minute tutorial for 3 hours total. If you skip the tutorial, it does not add to your overall time. You still only have 2 hours and 45 minutes to take that shelf. Study resources that are important, and you'll hear about them 1,000 times. The NBME practice exams, especially the 2 most recent ones. Those practice exams, you will have questions where the same STEM is on the exam that you're taking as the practice exam you took. So at least in the last 2 weeks before your shelf, take that practice. UWorld and AMBOSS, you will get a new version of UWorld that has each of the section headings for your core rotations. And then you'll also have access to AMBOSS in your clinical year. Use either or both, whatever works for you, but do a complete study bank if you can. It is good for you. Anki, if you like Anki, use it. And then there's the YouTube shelf reviews, which again are wonderful. I cannot stress this enough. Having something that helps remind you, right, especially in the last couple of weeks, is wonderful. Like Divine Intervention, Emma Holiday, but some of her stuff is a little out of date. You'll learn more about that later. Hi Guru, Melman, Dr. High Yield, they're all wonderful possible options. And so just a couple of tips for it. People call this one step 1.25. Family medicine, internal medicine, and pediatrics, those are all very general topics because they encompass so much about what those patients could have. It's not very specific the way that surgery is, the way that OB-GYN and psych are. So they're tougher shelves. You have to know the USPSTF guidelines and not just the A guideline, because they will have told you that they did the A guidelines. You have to follow, you have to know the steps. And you'll be able to access, there's plenty of Anki decks that are being made every year that have all the information. It's also all online. AMBOSS covers them pretty well. And for family medicine, don't forget ambulatory medicine. Those practice questions are incredibly valid and important towards this shelf. If you feel like you're overwhelmed and you don't have time to complete all the ambulatory, focus on MSK and skin. Family medicine, more than surgery, is the MSK exam. People get confused by that, but family medicine is the MSK exam for sure. Your high yield topics are INTEG and MSK. And your bread and butter is your hypertension, hyperlipidemia, diabetes. You got to know them. You got to know what drugs to give and why. You got to know the USPSTF guidelines for screening. You got to know when that screening is different for men and women, for smokers, non-smokers, but you'll have time to learn it. You can definitely get this done. Family medicine, people don't love this shelf, but they also don't hate it the way they hate the internal medicine shelf. And you will, of course, you'll see it in the clinic all day, every day. Every patient is coming. If your patient is 60 years old, they have hypertension and they're probably diabetic. It does not matter how they look physically. They're just going to have it. You're going to get used to it. And don't forget that because family medicine is a little bit of anything, everything is fair game. Just because you didn't see it in the clinic or don't remember doing a practice question on it doesn't mean that it's necessarily the wrong answer. Like, I think family medicine is the one where I had some very specific old material come back up on my shelf, especially, again, anatomy stuff. That comes up like crazy on this shelf. Do you guys have anything to add? Anything you guys would like to add? And yeah, like Hannah said, take as many practice tests as possible. Super important. Lauren, were you going to add something?
Yeah, if it's okay. So I actually too, like with this shelf exam, I also had a lot of OB and peds on here. So those were both rotations I hadn't done yet. So the big thing with the shelf exams is they're going to help you as you progress. You're going to see topics in one that when you get to it eventually in your next rotation, it's going to overlap. So that does help. But yeah, definitely wanted to reiterate what you guys are saying. Like, every topic is a possibility. So definitely don't get too overwhelmed and try and stick to high yield, but those things are options. So if this isn't your first rotation, carry on some of those things that you've learned in your other rotations to kind of help you as you go with it.
That's 100% true. My first rotation was internal and I got like 3 OB-GYN questions that I was very thrown off by. Family med, you'll get OB-GYN and peds for sure, because family is the entire family. It's not just adults and it's not non-pregnant women. So you'll get it all. It's just very specific to the guidelines. And Megan is right. I think the NBMEs is honestly even more important than UWorld. If you can only complete one, I would focus on the NBMEs because they are so much the practice NBME exams, because they are so similar to how the shelf is that it helps you to start thinking the way the shelf wants you to think. Anybody else have anything to add?
I was just going to reiterate, I know that you have it on the slide, and if USPSTF is so important, and I know that sounds foreign to people, that's a guideline, and you'll learn so much about it when you do family, and you're going to hear it 30 more million times when you do your family rotation, but it is so important. So honestly, I would start on day 1 and learn your USPSTF guidelines, and before you go into any patient, just review them in your head. What might this patient need? At least on my shelf, it was huge.
To answer your question, we do not get to choose what rotation we start in at California Hospital. I do know there are some hospitals in Florida that if you say, I want to start with peds, if peds isn't full, they'll like accommodate that. So if you're picking a rotation that's not full, then they might try to accommodate it. But at the end of the day, for the most part, you're randomly assigned where you start out with. Like, I personally didn't love starting with internal medicine because it's such a big topic to start with. But, that's the hand I was dealt. I know my classmates that started with surgery really, really did not love starting with surgery because it is a tough one, but that's the hand we were dealt. Yeah, USPSTF. And one thing I cannot stress enough is you have to be studying throughout the entire rotation, because you are going to be asked questions on the floor throughout the entire rotation. In the clinic, if I said my patient has hypertension, they would look at me and say, so by what guidelines do you want to treat this? And I could not stand there after week 1 and be like, I'm not sure. You have to act like week 1. for the most part, they're comfortable with you. You're still learning. It's only 6 weeks though. So by week 2, week 3, you've got to start picking it up. You got to start knowing the material. I had Dr. Gill, and he's a very kind, very gentle sort. He's not making you feel bad, but he wants you to learn it. And he's going to ask you a question over and over again to make sure that if you didn't get it right the first time, you knew it on the second try and you know it on the 5th try too. He's going to keep going. I recommend starting day 1.
I just want to throw this out there that it also depends. I think we kind of hit on it a little bit, but it also depends on like the order of your rotations. Like Lauren had said earlier that she got some OB-GYN questions and like peds questions. I started with family. It was my very first rotation. So I didn't have like any sort of like base of any other of the other stuff. So when I say like that this people describe this shelf as like step 1.25, it more so means that people describe internal medicine as 1.5. And so it just if you're taking family before internal medicine, I would definitely day 1 start, because on internal medicine you get 12 weeks, on family you only get 6, and there's a lot of overlap. Not to like scare you, just to try to like, I came in thinking, oh, I made it through the hardest part. I got through step 1. We're good, and didn't like really realize how much I really needed to study for this stuff, because we've learned the basis of how to diagnose based on clinical presentation, like history and physical exam, but we haven't taken the next step of like next best step in management, or like what imaging is needed after this, or again guidelines and things like that. So just my little 2 cents on when to start studying and like the order of your stuff.
Yeah, exactly. And okay, so when do you take your shelf? You book your shelf date yourself. They send you a testing permit and you book it yourself, and your testing window is the last week of your rotation and the first week of the next rotation. So depending on what shelf you're taking and what your next rotation is, some people feel comfortable booking it into the beginning of their next rotation. I don't necessarily recommend this. I recommend, if you need it to take the time, put it Friday or Saturday on the last day of your rotation. That way you can have, you've done your whole rotation with the studying, and then on the last day of your rotation, you can take the shelf. The shelves, usually there is no time between rotations. You end on Friday, you start back the next Monday. So there's a weekend. But yeah, so for your shelf exam, that's just like, I personally think that the 6 weeks after your first one is going to be your hardest shelf no matter what, because it's the first one you do. Unless you do psych first, because psych is generally pretty easy, your first one's probably going to be your hardest one. And everything builds after that. Like peds, I thought was not that bad because I'd already done internal. But my friend that started in peds thought peds was the hardest one by far. And she thought internal was easy. But it's because you're studying the same type of material, but just with a little bit of different specifics. Like family med is internal, but with guidelines. Like the guidelines are the focus. Internal is internal, but it's diagnosis and management is the focus. They're all kind of the same. When do you find out which rotation you're going to after step 1? So after you take step 1, you get your passing score, you submit it to Ross, they send you back, you get to rank your top 5 options for where you want to do your rotations. So for me, I wanted to stay in California. So I put the 2 California hospitals for all 5 spots. I said, I don't care which one, but put me in California. If that had been full though, and they hadn't been able to put me in within 3 months, I believe the rule is 3 months. If I hadn't been able to start within 3 months, they would have just given me a random spot and told me good luck. Or I can deny it and try, but you have 3 months to start. So be aware of that when you're picking your spots. Is some variety, you can't just pick one, because if it is full, they will give you a random one. So if everybody wants to do Ohio, but Ohio is full, please put down what your next possible option is, because if you do not have it, they'll be like, here's Florida. And maybe you did not want to go to Florida. Also, what was the other question? When did you guys do most of your studying? I studied honestly a lot during the rotation. If I wasn't writing my notes or like seeing patients, I did a lot of studying just like sitting at the desk. I had Anki on my phone, or I'd bring my iPad and I'd do some studying. And studying on the weekends is good, but we're all living, we all have to grocery shop and do laundry and everything else. So getting your study done on the days that you're like in the hospital is nice because it lets you have at least a day on the weekends to breathe. But everyone's different. Some people can study late at night. Some people like to study in the morning before they go to their rotations. You'll find your flow as you go along. What I will say is, generally speaking, what works for you will continue to work for you. If you like Anki right now, you're gonna like Anki in clinicals. If you hate Anki right now, I'm not saying you shouldn't try it, but clinicals is maybe not the time to start testing it out. 6 weeks is not a good amount of time to get used to Anki. If you like practice questions, focus on the practice questions. If you like videos, use online med-ed, use Divine, use whatever you want. There are textbooks assigned, at least at my hospital, we get an assigned textbook, but outside of surgery and internal medicine, there's no expectation that we actually read them. They're just the suggested textbook. Also on Canvas, Ross has suggested textbooks as well that you can download from the hospital. So if you're a textbook person, you can download those. First aid for step 2 is not going to work. It's not the same as first aid for step 1. I would actually recommend reviewing your first aid for step 1 to supplement your studying, because getting that pathophys down, like back down when you haven't thought about it for a while, is way more important than the way first aid for step 2 is all cases. Yeah, do you recommend any apps for the family med rotation that helps with looking up family med material? I used Amboss throughout my rotation. I would say because Amboss keeps pretty updated with the USPSTF guidelines. Amboss worked very well for me when I was asked a question. If I said, I don't know that right now, but I can go look it up and we can talk about it later, which they love. I would go on Amboss really quick and be like, all right, what is this? What is the diabetes medication if you have certain illnesses? But yeah, that was for me. Anybody else have something they want to share?
I agree. I use Amboss more so if I have downtime and I want to review something that a patient may have presented with. I don't find many of the apps to be super helpful personally. I really think that this is a good time to emphasize that less is more here on this side of medical school. I know that on Island, the more resources you had, the better. This is kind of the opposite. I would find 1 or 2 things that really, really work for you, and I would stick to that. If you really do like Amboss, or you want to take some time during your day and read up on a patient, then I would do that. I think I saw maybe Megan said MD Calc. There's random apps that are useful, but I wouldn't overload yourself. And you'll find that too as you're going through. Preceptors or residents will be like, hey, I use this. This is really helpful. Like one day a resident sat down and had me download like 7 apps that were helpful. So you will find your way as to what works for you. I have not touched any of the apps the resident told me to download. So that also might tell you how useful they may be.
Yeah, the only app I've used regularly is MD Calc. And it's much more useful in your electives, because electives, they will ask you things that are outside the scope, and they're like, how much of this drug should I be giving? And you're like, bestie, I don't even know that. But you do need to know that, because they're asking you, and you cannot just say, I don't know. So you pull out your phone, you go on MD Calc, and you do some quick math, and you hope you did the right one. And they tell you if you're wrong. I love electives. Anyway.
Another app that's like super helpful for especially doses, medications, contraindications. I've had a couple of preceptors reference Epocrates. I can put it in the chat as well. But that's a good one too. It gives you kind of like doses based off of, they have peds doses, adult doses. Sometimes a preceptor will say, hey, is this a common like adverse effect? And you can do that too. So yeah, I would say MD Calc and Epocrates are the two major ones that docs will be like, hey, pull out your device, check this. And then I definitely used Amboss a lot too. A lot of their stuff is also goes along well with, or like follows with up to date. So usually as up to date's updated, usually Amboss is pretty much in line with that as well. And I know up to date's a little bit more difficult to try and get on your phone because we have to go through all the sign on verification and stuff like that. So I feel like Amboss is a good quick one that you can just pull up on your phone.
Yes. Also, yeah, it was answered, but Joseph, if you take it on the last day of your rotation, you are 100% able to get the day off. I've never had a problem with that. Technically speaking, we have a certain amount of days off per rotation, but they're not to just be used like, you can't just take a day off. It's if you get sick, and some places will ask for a doctor's note. I know people that got sick during our surgery rotation and were asked for a doctor's note. There's also, and then it's if you have to leave to go to a conference or take your shelf. But again, I think it's 3 days for a 6-week rotation. And if you go 3 days for a conference, then you've used your 3 days and you're not necessarily guaranteed that 4th day to take your shelf. So plan ahead, think it through. You go ahead.
Oh, sorry. I was just going to say bounce off that. It really depends on the site because so each site has a, like, I can't remember her title for us. It's like a SPS or something like that, which is a student coordinator. She's employed by Ross. Ours handles our time off. She lets you take your 3 days off for anything. But that's not the case for every site, right? Like Jordan just said. So I have a kid and like if they're out sick or if like there's a snow day or something and I just can't swing it, she will get like work with me. Or if I already know he's out of school and I have no one, she'll work with me. So there is like situations like that, but she doesn't just let you take more than 3 days off. You have to make up time if you like miss more than what is allotted for you. And it's 3 days for a 6-week rotation, 6 days for a 12-week rotation. And then obviously when you get to 4th year, which is on down the road, you get 2 days for the 4 weeks.
Yes. I was gonna say, oh yes, okay, you guys are answering Justin's questions about the Ohio rotation. Good, because I would not be able to answer those. The one thing I can say is I do know Ross does not give preference to anybody. It is entirely by order of who applied for it. So if you took step one today, you got your score in a week and you submitted it that day, then you're put in line. So if when you get to the front of the line, there's also an opening at Ohio, then boom, you get Ohio. If there's not an opening, they will put you somewhere else. They don't take into account anyone's, unfortunately, needs, personal or otherwise. You can deny it and try to keep getting Ohio, but their policy is that you have to start within 3 months. So if you deny it, if you defer and like you go to the back of the line basically, and you're basically just every time you're on the line, you're trying to meet up with wherever your site was opened. During COVID, they were more open with letting people continue to wait until a point opened up. But now that COVID's over, they're like, okay, we need you to be in and starting as soon as possible. Not very convenient, unfortunately. I will say also that I believe, and I think it was said also, Ohio is one of the smaller sites. So they don't have nearly as many options. Like I think Hannah can tell you how many people there are, but I know for us, we always have, I think like 60 students rotating here. I don't know how many Hannah has.
We are so teeny tiny. I know that we've had quite an influx of people over the past few weeks, and we are not given the exact number, but a few months ago there was only 15 of us. So I would cap it out at maybe not even more than 20. We are very teeny tiny.
It is not possible to change your place once you're in cores. You have to complete your full year of cores at a site. The only times I've heard of people switching is if they if they were kicked out of a site, which is not good, you don't want that, or if their site had issues and they had to be moved to a different site. You don't get to switch sites once you started. You have to complete your core year. But once you're in electives, then you can go wherever you want. Let me see if I missed any. And guys, please you could ask questions about anything. It could be about family medicine. It could be about, like, if you want to ask questions about STEP, you can, but it has been a minute. It could be about anything you want.
I think Calvin asked something about there's like a guaranteed back home program. We did not have that option whenever we were in basic sciences. So I cannot personally answer any questions. I don't think anyone else can here. So that's just something you would have to refer back to the program. If they like give you preference on somewhere, then that's amazing. I'm really jealous, but I don't think that was an option for us.
Yeah, I've never heard of that before, to be honest with you. Never once. There are not currently, electives in Canada. I have heard that people have done it in the past, but I don't know about anyone recently doing electives in Canada. That is difficult though, because like Canadian people would know, your medical system is very different from ours, and the medical school system is very different from the American medical school system.
Yeah, I'm not Canadian, but I do know someone who is at my site that was just talking about doing electives in Canada. So I do think it's possible. I don't know how far along he is. I know he's like finishing up his last core. So I don't know how far along like in the process of coordinating that elective is. So I apologize, I can't speak on it, but hopefully I can probably drop his email to you personally and maybe see if he has more information for you.
And then electives are not just at the hospitals we work at. Those are just the easiest ones to get electives at. You can apply to do electives at any hospital that takes IMG students. So if you want to go do like a med-peds elective, there are some, actually, sorry, at any hospital within the states we're allowed to apply at. There's a guide you're going to be sent once you get closer to electives. Like we can't do any in Nevada. Sorry to Nevada natives. There's certain places we can't do them at. Yeah, Singh, I see your hands up.
Yeah, hi. So since we're on the topic of doing electives outside of the hospitals that are offered, have you guys heard anything about like the tuition, how much tuition it would be? Is it extra tuition if you're going outside of what Ross offers to do your electives? Or even if you're just doing your course outside of where Ross is offering, do you have to pay extra?
Yes, you do. Can anyone else speak on this or?
One thing, to my knowledge, we are not allowed to do our cores outside of a Ross hospital. That is something I think we are not actually allowed to do for cores. Electives you can, but cores no, to my knowledge.
So I can speak a little bit on doing electives. So basically what you have is you have a Ross, like they have established a contract affiliated. Then you have non-affiliated that you do not have to pay for. And then you have ones like I'm currently working with Emory University in Atlanta, Georgia, to set up a contract, which other Ross students have done in the past, but setting up a contract. And basically, you do have to pay an application fee and you do have to pay for the like the certain amount of weeks based off of their tuition, and Ross will reimburse you based off of their tuition guidelines. So if there's a difference, you do have to eat that money, but Ross will reimburse you, quote unquote, for whatever like they're okay with cost wise, if that makes sense. So let's say like it's $4,000 for the elective I'm doing, and Ross, these are all made up numbers, so don't quote me on it. But let's say Ross only will reimburse, or like their tuition is 3,000, right? I have to pay, technically I have to eat that difference of 1,000. That's how it works typically if you're going for a non-affiliate that Ross has not established like a contract with. There's three different like ones. So I'm about to drop in the chat an elective clerkship guide. It's not up to date 100%, but it gives you kind of an idea of where you could potentially do some electives.
And it's not that you have to fork up that money of your own pocket. It comes out of the disbursement that you would be getting. Just to be clear on that, it's not like, and you produce $1,000 yourself. You get a disbursement that covers like your personal needs while you're here. So your rent, your utilities, food, room and board, all that stuff. And it's usually like a little bit more than you need. So $1,000 isn't usually crazy, but you will feel it in some of the months. You won't necessarily feel it all the time. Is it tedious to set up a non-affiliated elective? If other students have done it before, no, not really. If students have not done it before, absolutely yes. It's very difficult. The more students that have done it at a hospital, the more Ross has connections with them, and they have worked with Ross, and so they know how Ross works. So if you've heard of us doing things at that hospital, go forth. If you've never heard of a Ross student, I'm not saying you shouldn't do it, but I am saying plan ahead, just like Jen said. Start early. There are like, how often are you given reimbursements? It is semester based. So you get it like January, June, and September, I think.
Yeah.
Like every the trimesters.
It also goes based off of like when the end of your clerk, or not, I guess the end of your rotation falls. So like I had family then IM for my first, so like that included a 16-week semester for me. And once I got done with IM, then I started surgery and OB-GYN, and those were like another semester. So I was reimbursed like basically on a 16-week thing, but then the last one was only a 12-week, I think. So yeah, it's based off of the weeks that you're in. Like they won't reimburse you in the middle of a rotation. So that's how you calculate it up.
That also gets tricky. Oh, sorry.
No, go.
I was just gonna say that can get tricky. I got caught one time. Not caught. I didn't do anything. I was in a situation one time where, sometimes school will give you too much money, I think, and then you end up owing them tuition. You can get on a payment plan. I didn't know about this. Nobody told me that this is something that can happen, and Ross won't really tell you until all of a sudden you owe them money. So I was stuck in that situation, and I was in the middle of a 12-week rotation, and I had like just started it, and the semester was starting over while I was in that 12-week rotation. So like Megan said, I didn't get my disbursement back until after that 3 months. So just be really smart about the money that they give you. It is supposed to be for your tuition, or excuse me, your rent and your food. It's going to be a fair chunk of money, especially if you're living in an expensive place, but there are things like that that can happen. So just be really smart about what they're giving you, and stay up to date. If you go on my Ross, they'll tell you if you owe anything. Just be conscious of that.
Yes. Whenever you get your allotment, when you're in cores, it should be, I'm just gonna say it should be less than $20,000 while you're in cores, unless you've applied for something else. If you get more, call up Ross within the first week and say, I've received too much money, and you can send that back, and they can handle it. Or if they made a mistake, it can be handled within the first week. If you don't know to do that, because Ross does make mistakes. I will also say that when it comes to your financial aid, like I'm in California, like I'm in downtown California, downtown Los Angeles. It is expensive to live here, but also it would be expensive for me to commute from far away, even though a lot of students do that. So, figuring that situation out, do the math for yourself if the rent is worth where you live. I'm just going to say, because there's a question here, as a student, is it in clinicals, does it expect that you will get holidays off and semester breaks? I don't know what you mean by semester breaks. I have not had a break. Holidays, it depends. It is, technically speaking, it is the right of your preceptor at my hospital. I know other hospitals are different, but I was in surgery this last holiday season. So I worked Thanksgiving and I worked Christmas. I only got one holiday off, and I picked New Year's because I live alone. Other people, like in other rotations, people that are on IM, they got the full week off for Christmas. I was very jealous of them. So it's different based on your preceptor and based on your hospital. I think technically as Ross students, we're supposed to have them off, but yeah, that's the breaks. Your preceptor owns you, so that's kind of the breaks. I will say, and again, I do not know what you mean by semester breaks. I do know at Michigan, Megan, you said that they have like a week summer and a week winter, or 2 weeks, I think.
Yeah, in July it's only in third year, you get a 2-week break in July when residents start, because they don't want medical students in there and brand new residents to mess everything up. And then there's a 2-week break at Christmas that you get. And actually we got like a 2.5-week break this year because of the way that New Year's and Christmas fell, with it being weird in the middle of the week. So that was nice.
Sing, I see your hands up again.
Yeah, so just 2 questions. When did you guys find out exactly, like, was it a week before or 2 weeks before that you started your first rotation? Like, when did you find out what rotation you were doing? Was it psych? Was it peds? Like,
So for me, what happened was I checked Medtrix the second I was assigned, and it said that I was starting in surgery. So I was like, oh my gosh, that's so scary. And I did the entire surgery onky deck. And then the week before I started, I checked again, and suddenly I was starting an internal. So I was like, oh, that's really cool. It was like 3 days before I started, but suddenly on Metrics, I was starting an internal. I got the information about orientation, and that included like my internal med orientation and my hospital side orientation. I got that information 6 days before I started. So,
wow.
like, you know what hospital you're going to be at. You'll know that however much in advance your gap is. For me, I had a 2.5 month gap between passing step and starting. So I had time. I know one of my classmates who started here at California Hospital, she had 2 weeks because they were like, you want to start immediately? And she said yes. And they said, okay, you can start in 2 weeks. And so she had to move from Texas to California in 2 weeks. And she has kids. It was crazy. But you do what you have to do.
Yeah. Okay. Thank you for that. My second question is, so you're, I don't really know. You said psych is 6 weeks. I think you said whatever it is, right? 6 weeks, 4 weeks. So once your rotation ends, how much time do you have to take the shelf? And then, like, how much time until your next rotation starts? And
So
I believe, is it only 1 week?
No, you don't have time off. You're misunderstanding. You have a window that is the last week of your rotation and the next week of your next rotation. There is no gaps. You start, so say you start Monday, you do 6 weeks of psychiatry, and at some point between the last week of psych and then starting family medicine, you have to take the psychiatry shelf. You can take it on a weekend, as long as you book it early. Or you can take it, again, I recommend during the end of your psychiatry elective, but it's not like you have a gap to study or a gap to take it. There are no gaps. The expectation is that you are studying during your 6 weeks. It is now up to you. You're studying during your 6 weeks and you're taking it during the rotation itself. There is no gap.
So someone said, like, you can use your sick days, that the 3 days that you get to take that time off and study. Is that possible?
Absolutely. That is a lie. That is a lie. You should not take sick days off to study. You should not do that, because you do not want to be saying, oh, I'm sick, I would like time off, and lie to your preceptor and have them go, okay, send me a doctor's note. It's not fun. If you ask a preceptor for time at the end of your rotation, like I asked if I could have the Thursday off before my shelf, because my shelf was on Friday. I said, can I have Thursday off before my shelf? And he said yes. But I know my friend at Dr. Lavi's clinic asked the same thing, and Dr. Lavi laughed at him and said no. So every preceptor is different. At our hospital for internal medicine, they choose to give you the last week of internal medicine off so you can study and take the shelf during that last week. But they don't have to do that. That's a choice that they make because they're nice to us. Everyone's hospital is going to be different. Every preceptor is going to be different on their expectation of you. You
Alright, thank you.
again, you can, if you feel scared, take it during the first week of the next rotation, but because you don't know that preceptor, I cannot recommend that. It is not a good idea to take it in the first week of the next rotation when they don't know you and you don't know them.
You can take it that Saturday too, by the way. So like my surgery and IM ones I took at the end, but just remember that if you're taking it on a Saturday, that is the last day you can take it. Prometric sites are not open on Sunday, so if something goes wrong, you're kind of SOL. But yeah. Um, and then there was one other thing I was going to say. Oh, your shelf. Hannah said it. You get your score depending on your window. You'll get it if you take it at the end of your window, you'll get it like the following week. But if you take it at the beginning of the window, obviously you have to wait longer because it's not till the end of the window that they release the scores.
Yeah, everyone gets their scores the same day, regardless of when you took the shelf. Everyone's going to get their score the same day. That is in your site at your rotation, because none of the rotations start at the same time. I know like Megan started before me and finished like a week before I finished my last rotation. Like everyone's rotations are staggered based on how their hospital runs it.
Yeah.
The
I
only things that are
started
linked up
like
are electives.
Sorry, Jordan. I
You're good.
started like almost an entire rotation before Jordan, but because Michigan has I mean, obviously we love the 2 week breaks, but because we have those, me and Jordan fell like almost in sync of like ending our rotation, our third year. Like I finished only a week before her, sort of thing.
And one thing you have to be aware of is if you're worried about your timeline for starting, you want to see, like, you may want to be open to where you start your course. Because, like, for me, I took STEP in November and got my grade December, started February. I know somebody who took STEP in December, got his grade like 3 weeks after I did, end of December, and he started immediately in January because his site had faster turnover than me. So if you want to be like going quicker and just start immediately, being open to where you're placed and just is good. But if especially for people that have families, people that have different responsibilities, people that just have connections to an area. Like I didn't want to leave California. I'm California born and raised. I didn't want to leave it. So I wasn't willing to go to Florida, even though Florida would have started me within a week. Yeah, it's rolling start. So it's every 6 weeks there is a start date for people, unless it's full. So every hospital has that. Scrolling up. Okay. I don't believe you get to choose your start date. It is entirely based around when you took STEP and passed it.
Yeah, Michigan is a rolling basis. There's only a few that are like not rolling basis. I think Kern, right, Jordan, and then a few others. Michigan's a rolling basis, but it's based off availability. And I do know that they like have partnered with Wayne State students, like their medical school. And so I think that that's like they're trying to figure out how to incorporate Ross and Wayne State together, but that's neither here nor there.
Yeah, Kern Medical is unique because it starts only, okay, they're kind of going back on this now, but it used to be that they started only in August because they've re-upped their old contract with UCLA. So now at Kern Medical, there's sometimes UCLA students going through. But yeah, so there was a point where they were only starting in August, but I've been told that now they're accepting some students. It's very site dependent, but I know the main ones like LA, New York, Michigan, Florida, all rolling.
And the reason it takes like 2 to 3 months after you pass step is because they like only enter every 6 to 12 weeks, I guess. I guess technically every 6 weeks, like is whenever a new rotation starts. So that's whenever they will allow new people to come in. So I would expect if you pass Step one, like once you submit your contract of the 5 preferences, I would go ahead and kind of expect maybe like a 6-week potential, like at least time to between placement, if that makes sense what I'm trying to say.
Yeah. And like it's not just like, oh, everyone at a rotation starts at one site. Like when I started, I had orientation with 6 people, and one girl started in psych, one girl started in peds, 2 guys started in surgery, and then myself and another person started in internal. Like we were all broken up to start elsewhere. And so you're rotating with people. Like when I was in internal, there were 12 of us on internal, and I want to say 8 of them, it was their last rotation. And then like myself and the person I started with, we were in our first, and then everyone else was in like their 4th. Like it's staggered, but usually you have one person that you'll do most of you'll that will, at least at California Hospital, you'll have one person that will be on your track with you, and then everybody else will be split up. That's just how it works. I don't know if it's different at the other hospitals, to be honest with you. Are there any other questions? I know we've talked about a lot. It can get a little overwhelming, but it's good. If there's no other questions, I'm gonna, let me click forward. Move forward. Thanks, guys, everybody, for coming. Please follow us on Instagram. You can DM us questions if you still have questions, especially about family medicine. We're always happy to answer. Again, though, thanks, everybody, for coming. And yeah, Lauren just dropped her number. She's a great resource. She's wonderful to talk to. She's super nice also, so that's fun. But yeah, feel free to reach out. And, best of luck to everybody at this part of your journey. And happy to see you guys going forward in clinicals soon.